Pulmonary tuberculosis. Tuberculosis is an infectious disease caused by Mycobacterium tuberculosis. It's a contagious airborne infection in which it primarily attacks the lungs, but it can also affect other organs of the body, including the abdomen, bones, nervous system. Mycobacterium tuberculosis spreads from person to person through tiny droplets released into the air via coughs and sneezes. People with a extrapulmonary tuberculosis or a TB infection that occurs outside the lungs do not spread the infection. Sometimes the infection does not cause any symptoms. This is known as latent TB. It's called active TB if you have symptoms and if it makes you sick. However, in some cases, symptoms might not develop until months or even years after the initial infection. Pulmonary TB is curable with an early diagnosis and antibiotic treatment. What is latent TB? Being exposed to Mycobacterium tuberculosis doesn't necessarily mean you will get sick. In most healthy people, the immune system is able to destroy the bacteria that cause TB. You will not have any symptoms, but the bacteria will remain in your body. This is known as latent TB. People with latent TB are not infectious to others, but it's possible for latent TB to develop into active TB. Many people with latent TB eventually develop active TB years after the initial infection. This usually happens when the immune system is weakened. For example, if someone is on corticosteroids or having chemotherapy treatment for cancer, so treatment is important. Causes. TB is a bacterial infection. TB that affects the lungs is the most contagious type, but it usually only spreads after prolonged exposure to someone with the illness. The infection may stay inactive for years. Risk factors include if you have recently spent time in a country where TB levels are high, in prolonged close contact with someone who is infected, or being around family or friends with TB, living in crowded or unclean conditions, older adults and small children, drug abusers and people who smoke, people with an autoimmune disorder such as lupus or rheumatoid arthritis, people with weak immune systems such as diabetes, living with HIV, undergoing chemotherapy or taking chronic steroids, and poor nutrition. Symptoms. TB is airborne, which means you can become infected with Mycobacterium tuberculosis after breathing air exhaled by someone with tuberculosis. This can be air from coughing or sneezing. The germs can stay in the air for several hours. It's possible to inhale them even when the infected person is not in the room, but usually you have to be close to someone with TB for a long period of time to catch it. Not everyone with TB is infectious. TB infections usually spread between family members who live in the same house. It would be highly unlikely for you to become infected by sitting next to an infected person. Typical symptoms of TB include coughing for 3 or more weeks, coughing up blood, chest pain, pain with breathing or breathlessness, wheezing, unexplained weight loss, fatigue and tiredness, fever including low grade fevers, night sweats, chills, loss of appetite. Tuberculosis can also affect other areas outside the lungs, including the lymph nodes, bones and joints, the digestive system, bladder, reproductive system, brain, and the nerves. TB affecting other parts of the body is more common in people who have a weakened immune system. The symptoms of tuberculosis vary depending on which part of the body is affected. For example, tuberculosis of the spine might cause back pain, spinal deformity, and tuberculosis of kidneys might cause dysuria, nocturia, and blood in your urine. Diagnosis. Several tests are used to diagnose tuberculosis depending on the type of TB suspected. During your examination, healthcare provider will conduct a physical exam, ask about your medical history, schedule a chest x-ray to look for changes in the appearance of your lungs that are suggestive of TB. If you are a TB patient, your physical exam may show swollen lymph nodes in the neck or other areas, fluid around a lung, and unusual breath sounds. Your doctor may order a sputum test to confirm pulmonary TB. Samples of sputum at 3 separate times will be taken and checked for the presence of TB bacteria. In addition to this test, your doctor can also culture a sputum sample. Other exams. The following exams can also look for pulmonary TB. Tests that may be ordered include bronchoscopy, that inserts a scope through your mouth or nose to view your lungs and airways, chest CT scan, an imaging test to check lungs for signs of an infection. Chest X-ray is a rapid imaging tool that helps in easy identification of lung abnormalities. Thoracenthesis, a procedure to remove fluid from the space between the lining of the outside of the lungs and the wall of the chest. Lung biopsy, a procedure to remove a small sample of lung tissue. Extrapulmonary TB tests include a biopsy. A small sample of tissue or fluid is taken from the affected area and tested for TB bacteria. You may also have a lumbar puncture where a small sample of cerebrospinal fluid is taken from the base of your spine. The sample can be checked to see whether TB has infected your brain and spinal cord. Tuberculin skin test or Mantoux test. The Mantoux test is a widely used test for latent TB. It involves injecting a small amount of a substance called purified protein derivative into the skin of your forearm. If you have a positive PPD, it means you have been exposed to a person who has tuberculosis and you are now infected with the bacteria. Your skin around the site of the injection should start to swell and harden by 48 to 72 hours. This bump or induration will also turn red. If you do not have a latent infection, your skin will not react to the Mantoux test. The size of the induration is used to determine your results. However, as TB can take a long time to develop, you may need to be screened again at a later stage. If you had the BCG vaccination, you may have a mild skin reaction to the Mantoux test. This does not necessarily mean you have latent TB. Thank you.